I'm Christina Kaiser. I met Wendy Dolan years ago due to akathisia. Wendy and I both have a early background in education. Wendy went on to get a LCSW and MSW and is a certified family therapist in private practice for more than 35 years. We both do have education backgrounds, and today we are going to give you, I promise, the best overview of akathisia. So you'll see videos, you'll hear from first-person accounts, best practices, and how clinicians can recognize it, not just in their own practice, but in their own families and friends.
Hi, so I'm Wendy Dolan. I'm the founder of MISSD, and we draw attention to akathisia. And akathisia is a word that most people have never heard of. But what I've been talking about all day today is that if you look at drug commercials on TV, may give you suicidal thoughts. This is what is known as akathisia. What I think is so important is, and many times, an internist, a gynecologist, or a psychiatrist is prescribing the meds, and they turn out to be the ones that are managing the symptoms. And I think it's really important for people to be aware. We're not anti-drug, we're all about just awareness.
So we're going to see a video that MISSD produced to give an overview. Some medication effects can closely resemble psychiatric symptoms, but they have nothing to do with why a person got the medication. They have nothing to do with their underlying condition. And today, one of the most serious and under-recognized is akathisia.
So what is akathisia? It is a side effect that occurs when you stop, start, or change the dose of any medication. And what happens is there are inner and outer symptoms, and the outer symptoms are easy to watch, the pacing, the can't sitting still. But the inner symptoms are very difficult because I feel like my brain's on fire. I feel like a veteran I talked to, she said, I felt like I had a battery on my tongue. And so these symptoms may resemble anxiety, depression, or agitation, but it is the drug side effect. And many times, I'm not saying that akathisia doesn't occur with psychiatric diagnosis, but sometimes propecia, they get a lost drug, now has a warning for suicide. The weight loss drugs, the malaria drugs, Accutane. So all we're asking you is just anytime someone starts a med, have a really good conversation. Are you feeling anything? Neural worsening symptoms, let someone know.
MISSD has been very fortunate to hear from people all over the world, and we've presented in many different countries, also awareness campaigns. And the best way to understand akathisia is to hear from experts by experience. So our Akathisia Stories podcast does just that. We go right to the experts by experience, the patients, and increasingly in medical research and healthcare conferences, patient experiences are being valued in a way that decades they were dismissed. So we want patient experiences to come right to you because we can read from a textbook or medical research and tell you what akathisia supposedly feels like, but Wendy and I haven't experienced it. So let's hear from experts by experience. So I'm going to introduce some of the symptoms. MISSD divides them into inner and outer. Some of the medical research does too, but we think for clinicians and consumers to say inner symptoms and outer signs is better because it tells you what's subjective and what is observable. So I'm not going to read all the slides because you can look at them also on miss.co, but we heard already from survivors about brain zaps, the electric sensations, the Trojan horse. One of the comments was the head is detached, so this depersonalization. I will tell you in medical research and in the pharmaceutical clinical trials, the head is separate from the body, the delirium or depersonalization. It is in the notes on some of these clinical trials. So it's not just depersonalization, it's actually kind of a delirium or a toxicity. Cognitive confusion, Intense inner restlessness, urge to move, insomnia. Either they can't sleep or they have violent nightmares, and the nightmares are very vivid, and that might play out in terms of the intrusive, out-of-character thoughts. Perhaps the early symptoms might be you have a nightmare, and then during the day, that violent, intrusive thought becomes more to the forefront. But the most important thing before Wendy goes over the outer symptoms is to remember that subjective distress is often the most prominent symptom. So subjective distress that you might not be able to see and they might not be able to articulate, but it's there.
So the outer symptoms obviously are easier to observe, but one of the things about akathisia, a lot of doctors would call it restless leg syndrome. They would think that that's one of the causes of that. Obviously, restless leg syndrome occurs, but it's the inability to sit still or in the constant moving. I mean, when we first started MISSD, I was not aware of something, and you learn about the 4 kinds of akathisia. One is forever, like even with stopping the drugs, there's still an inability to move. I've dealt with clients, people who reach out to us, and they literally can't stop moving, even though they've stopped the drugs. It's a lifelong one. It's just heartbreaking. This was a young man who took the drug because he had test anxiety, and now he can't stop moving. So there's that vacant look, agitation, impulsive behavior, rocking and swaying. I mean, the person can look psychotic because of the movements that they're making. But it's just what's so troubling is this inner and outer symptoms. They don't know what's going on. I mean, they simply don't know what's going on, you know? It's heartbreaking.
And movement may be subtle or temporarily suppressed. So what I want you to know when you leave here and you go online and you take the NASW certified course that we offer for free, you'll learn that tardive dyskinesia is not the same as akathisia. Last year we were presenting, I can't remember if it was Kansas City, but maybe Florida, but somebody there came up to us and said, there's a cure for this, there's a pill. And being experts on this, we said, no, there isn't. He was confused with tardive dyskinesia. Tardive dyskinesia is not akathisia, despite that the words rhyme. And the differences are great, but one thing you just have to remember is that the absence of obvious movement does not rule out akathisia. People who have akathisia don't always show movement, or they're able to suppress it for short periods of time, even if they do so subconsciously. So what can cause akathisia? We'd have to have a day-long seminar to tell you all the medications, but more than 100 different medications, from antidepressants to antipsychotics to hair loss to weight loss to hair alopecia medications, anti-malaria, asthma. Just remember this, akathisia is not limited to psychiatric medications, and akathisia symptoms, while they are psychiatric in nature, obviously many of them are adverse psychiatric effects. It has nothing whatsoever to do with why a person got the product or their underlying mental health. So when symptoms often appear after starting, changing dose or type of medication. And the most important thing to know here is that symptom timing is often the most important diagnostic clue. There are 4 types of akathisia. When you go online and take our course, you'll learn about them. We won't go over them today, but what you will learn is that all 4 types of akathisia have the exact same symptoms. They differ at onset. And we are going to have time for questions, and I'll get to you first.
So this has been something that we're very proud of. We do a lot of work with the veterans. Years ago, when we would do the Out of the Darkness walks with suicide, we had a T-shirt with the MISSD logo, the definition of akathisia on the back. Inevitably in this walk, people from the military would tap me on my back and say, I think that's what's happening to my loved ones. Through a board member, we became involved with canines for veterans, and we've been doing videos and lots of work with the veterans, because what they've discovered is with all this work that they tried to do to lower the suicide rate with veterans, they're not achieving a lot. Maybe a couple of years ago, but it's gone nowhere, they introduced a bill in Congress where they wanted to actually look at veterans who died by suicide and look at what drug combos they were at. So we produced this video, and we're obviously very proud of it.
If your client or someone you know, if they're at risk, you do need to go and seek emergency care, but you need to explain that it might be akathisia. Why recognition matters? Well, it can be life-threatening, and it has been associated with self-harm, violence, and suicide. A Harvard psychiatrist, Dr. Joseph Glenn Mullen, in the 80s, when SSRIs were having the FDA hearings, he said himself, this is not a traditional suicide if someone dies from self-sustained injuries while suffering from akathisia. It's not a despair, it's not depression, it's like a medication-induced toxicity, if you will. So you can't say, well, okay, my son's on Accutane, and Accutane does have a warning about suicide, but your son's a soccer star at Maple Valley High, and he's not depressed, so therefore you don't have to worry about your son. We can't stress enough that this has nothing to do with someone's level of happiness before they start a medication. It's not related.
But before we move on, what I want to say clearly about veterans, so I presented at a VA hall in the western suburbs of Chicago, and a guy came up to me, tapped me on the shoulder, and his name was John. And he said, I was on 18 drugs at one point. And he said, it's polypharma, and it crescendoed till he became violent with his wife. Thank God she's okay. And he got a dog from Canines for Veterans. But this keep on adding and adding and adding, and that's what's happening a lot. So I want to say that's why we're very, very concerned about our veterans. So we always say, you need to be a good consumer. You need to be a good consumer. And some people will say, oh, the doctor didn't tell me. Doctors don't know. This is not information that they're necessarily given. They're getting information that says that it's great, the medication's great. So what I think is important, and I learned this from the military, is that if your clients or people you know are starting a new med, just say to them, hey, let someone know you're starting a new drug. If I start to act different, let me know. Even for someone who lives alone, talk to somebody, because I think that it's just so hard because people keep thinking it's just your mental illness is getting worse. And so therefore you have to think differently about, like someone starting, like Christina said, Accutane.
Yes, and I would just say that you'll find out more when you do take our course. We have 2 courses. One is NASW accredited. It's offered for free. It gives you one, CEU. We have another course that anybody can also take, but it's geared more towards consumers and caregivers. So please go online. Our akathisia podcast story, I don't know of any other podcast that kind of specializes in this. And we won't play it today because we do want to have time
for this
questions. Probably not. I'll see, but when you go on our YouTube, you will see that in addition to some of the videos we just showed you, we have many more, and one of them we're kind of proud of is that the first public health video ever to include akathisia as a suicide risk factor. So that video is really about suicide risk factors, but akathisia is featured in it because MISSD produced that video in collaboration with another nonprofit called No Shame on You. So what we want to stress is please go on YouTube, TikTok, MISSD.co, take our courses, share that information. You cannot treat what you cannot name, and you cannot refer people for management if you can't name it. I do want to say before we take questions that while there's no definitive treatment, I don't want to leave anybody misbelieving that there's no management. We don't give medical advice, but what you'll learn when you take our course is that some of the traditional ways it's managed is to reduce the dose of the causative medication, to slowly titrate off the medication. In severe cases, they often give a short-term benzo, but that's interesting because benzos can be paradoxical and they can actually cause akathisia. But we don't give medical advice, but on the course you will see what medical research does say you should, what kind of avenues people will get relief through their medical provider.
When I learned about medication-induced suicide, it was always the rollback effect. I don't know if that's still currently talked about, that the drug made you manic and it made you act out your action. And I'm not saying that doesn't happen. But what I am very specific about is we want to broaden the definition of suicide. Like if someone had cancer, God forbid, one of the first things you say to them is, well, what kind? And we understand there's different types of cancers. There's different reasons people end their lives by suicide. COVID workers, people who were struggling with their sexuality. There were many reasons. And so this video I'm really proud of because it really shows all the different reasons. You lose your job, you break up with someone, and we're not doing a good job as clinicians unless we really say, hey, what's going on in your life? Any new medications you're on. So I think it's important for all of us to broaden our horizons, and that's why I think this kind of a conference is really important.
In the U.S., they don't have this label yet, but in many countries that are somewhat ahead in different ways, they have open verdicts. They have all sorts of, for example, Dr. Joseph Glenmullen from Harvard would not categorize an akathisia-induced death by self-sustained injury as a suicide. It's called iatrogenic. Iatrogenic means caused by medical error, medical intervention, medical harm. So in other countries, they do have open verdicts, and also they don't always assume that the person who might be jumped off a bridge was actually in their right mind trying to end their life. Many akathisia survivors who have had an experience that wasn't successful will tell you that they didn't know what they were doing, or if they did, they were just thinking, like if you're jumping from a burning building, you're just trying to stop the suffering, not end your life. But now I want to say I'm very proud that I'm working here with Wendy. Our stories are not unique. They're unique to us, but they're not rare. I do have an education background. Years ago, I was a crisis and risk communication specialist. I never imagined I would be communicating this kind of crisis or risk, but Wendy and I met because she lost her husband to akathisia, and I lost my 19-year-old to akathisia. Neither our loved ones were given a product for depression. So that's how we came together, and we just go everywhere and anywhere to make sure others are safer and better informed. Wendy, do you want to open it up?
Yes, any questions for anybody here?
Thank you very much. I have two brief questions. First, I wonder if this is more like short-term or long-term, like short-term meaning like in a few weeks and it will dissolve, or is that more like long-term? And my second question is like the percentage of population who receive psychiatric medication that may get anesthesia. Yeah.
I mean, we might as well talk about the 4 types of akathisia. It's based on timing. It's acute, that happens right away. It's tardive, that handles, later on. Chronic, which goes on forever. And then there is withdrawal akathisia, which is getting a lot of attention. People say, I'm just going to go off my med. So I think that was your question about timing.
Well, the interesting thing is that you were asking about percentage, and of course that's a good, curious question. So the issue is this, because so many adverse effects are not accurately recognized, that the percentage estimates are very low because they're not always reported. But when you take our course at miss.learnupon.co or miss.co, it will tell you in there the percentage is reported in medical research, but I will tell you it's very high, probably more than 50% when you're talking about antidepressants and antipsychotics. But it does tell you the estimates in there, and keep in mind that those are the best estimates because most adverse drug effects are not correctly recorded. Any medication that says restlessness, because not always do the product manufacturers call it what it is, so you have to sometimes read between the lines, but I would go on risk.org and look at their list of medications. Lastly, I want to say before we move on to maybe the final question is that years ago we were in touch with a famous actress. I won't say who it was, but you would know her. But she took Tamiflu, and Tamiflu is an over-the-counter medication. And she wrote an article about it, and she said, I had everything to live for. I've never been suicidal in my life, and here I just, Tamiflu. And the last thing she said was, I can't believe they give this stuff to kids. So we are talking about prescription drugs, but that are sold by pharmaceutical companies, but also over-the-counter drugs sold by pharmaceutical companies could cause it.
They'll mention about suicidality, like on page 32 of adverse drug effects, they refer to akathisia as emotional lability. I don't know about you, but to me, when you're emotional lability doesn't necessarily mean you're going to end your life about suicide. So do you need a microphone or?
Thank you. In the initial part of your speech, I think I heard inner restlessness, overwhelming urge to move, and cognitive agitation, and that imitates some of the DSM diagnosis. I was wondering if that overlaps with ADHD.
It's possible, but the real thing is that it's about timing of the symptoms. So the symptoms, when do they appear? If someone has, what you call ADHD, or I assume you're looking at the DSM label, if they haven't started, or changed a dose of any type of medication, well, you wouldn't really associate that with akathisia. But the problem is that the diagnosis can become more difficult if they got that label and then they're taking a medication. So that would be difficult to answer. But the key takeaway is that symptom timing is often the most important diagnostic clue.
But also, over last summer, we presented at the National Association of ADHD, and we take every opportunity we can. Veterans, crisis interventionists, whatever we can be, LD teachers, and inevitably, this conference was interesting, more parents were there of children who were taking meds, and our booth became super attracted to them. I can't believe we talked about that. My child was starting to talk about suicide. So the general takeaway, I hope for all of you, is starting, stopping, change a dose of a med. If you get new or worsening symptoms, it may not be you, it may be your med, and just to get help. I mean, we're passionate about this because our message isn't problematic. We're not anti-drug. It's awareness. Why shouldn't you be an educated consumer?
At that conference, the ADHD conference, many people, there were some pharmaceutical presenters, and when we went to get the information about some of those products, they clearly had either akathisia clearly listed or akathisia hidden in the fine print. So the question, I think, or the answer, so to speak, would be paradoxical effects. Somebody taking an ADHD product could get akathisia, and it doesn't mean their ADHD has gotten worse. Before you leave, please go to the table on the right. There are QR codes for the free NSAW certified course, akathisia podcast, newsletters. Everything we do is free. We take no money from industry or the pharmaceutical companies. We're a 501c3 nonprofit just to increase patient safety.
And one last thing, all we ask of you is if you found our talk interesting, you go back to your agencies or whatever, where you're at, say, hey, I learned about akathisia, go to miss.co and just educate your staff, yourself, and others. So thank you.